Procalcitonin, a biomarker in clinical practice. Understanding its role in infection and inflammation. Introduction to procalcitonin. Produced primarily by the thyroid gland and in response to systemic inflammation. Consists of 116 amino acids. Procalcitonin levels are very low in the blood. Increases in response to bacterial infections, trauma, and systemic inflammatory responses. Elevated levels indicate a serious bacterial infection or sepsis. Sepsis, also called septicemia, is your immune system's extreme response to an infection from bacteria. Sepsis happens when an infection you already have spreads into your bloodstream and triggers a chain reaction throughout your body. It causes inflammation and blood clots. Without prompt treatment, sepsis can rapidly lead to tissue damage, organ failure, or even death. Clinical significance of procalcitonin. Early sepsis detection. PCT rises rapidly in bacterial infections, aiding early diagnosis. Antibiotic guidance helps guide antibiotic therapy, reducing unnecessary use. Disease severity assessment correlates with sepsis severity and mortality risk. Treatment monitoring tracks treatment response and detects relapse. Bacterial versus viral differentiation aids in distinguishing bacterial from viral infections. Critical care risk stratification predicts mortality risk and guides resource allocation. When is it ordered? The procalcitonin test may be ordered when a seriously ill person has signs and symptoms that suggest a systemic or severe bacterial infection and/or sepsis. Chills, shivering, fever, clammy or sweaty skin, extreme pain or discomfort, rapid breathing, rapid heartbeat, confusion or disorientation, less frequent urination. What does the test result mean? Low may indicate lower risk of sepsis, non-bacterial causes, localized infection, or early-stage systemic infection. High strongly suggest sepsis, severe sepsis, or serious bacterial infections. Moderate might be due to non-infectious conditions, early infection, or kidney infections. Changes. Decreasing levels suggest treatment response, while stable or increasing levels may indicate continued therapy. Procalcitonin in antibiotic stewardship. Early detection identifies severe infections early. Differentiation distinguishes between bacterial and viral infections. Severity assessment guides treatment decisions and antibiotic dosing. Treatment monitoring assesses treatment effectiveness, reduces overuse, helps avoid unnecessary antibiotic use, improves outcomes, ensures appropriate antibiotic treatment. Limitations of procalcitonin. False positives. Conditions like trauma and autoimmune diseases can elevate PCT levels, potentially leading to inappropriate antibiotic initiation. Patient variability. Immunocompromised patients may not exhibit expected PCT responses, complicating diagnosis and treatment. Conclusion. Procalcitonin is a valuable biomarker in diagnosing bacterial infections and managing antibiotic therapy. Enhances patient care through better decision-making in infection management. Thank you.